How do we do the lumbar rotation? This is really simple. So you lay on your back, you grab your knees with your fingers, and you rotate to one side until you feel stretch here in the glutes, and you keep this position for 3-5 seconds. Then you move to the other side and you do the same. You need to feel the stretch in the glutes. You keep the position 3-5 seconds, and then you go the other side again. This is a really simple exercise, but it's going to help you to rotate the lumbar spine, to give some motion, and also is going to help you to stretch the glutes. Okay, now let's do the advanced version of this exercise. So we are going to increase the rotation this time. How do we do it? We flex just one knee, and with one hand we are going to rotate to that side we want to rotate to. So we keep this position for 3-5 seconds, and then we go back to the neutral position, and we do the same for the other side. We have increased the rotation. You can do it, but as I told you, this exercise shouldn't cause you symptoms, shouldn't reproduce symptoms. So make sure it gives a good stretch here in the glutes, but without causing you pain, all right? We can do it 10 times. We keep the position 5 seconds. You can breathe normally. It's not necessary that you inhale or you exhale during a specific movement. Okay, now I'm going to teach you a piriformis stretch, which is safe because it doesn't create loads on your lumbar spine, and you need to stay in front of a wall, and you need to place one foot on the wall like this. Then you keep your chin down, you cross one leg over the other, and we are going to create, in this case, we are going to stretch the piriformis muscle. We are going to create a tension by pushing the knee away from us like this. So, for example, here I already feel tension, I already feel the stretch in my left piriformis. I keep this position, maintaining the chin down. I keep this position for 10 seconds, then I breathe in. When I breathe out, I push some more, just a little bit, and I reach for the second tension point. I keep the position 10 seconds again. I breathe in. When I breathe out, I push some more, and I reach for the last tension point. I keep it 10 seconds, and then slowly I go back to the neutral position. Let's do it to the other side. So one foot on the wall, I cross one leg over the other. It's normal that you find one piriformis more contracted than the other. For example, as you see, my right piriformis is more contracted. So you can also place a pillow to stay comfortable. For example, as you see, as I was telling you, this piriformis, the right one, it's more contracted. It's totally normal. We are going to do it both sides. If you have sciatica, for example, you should do it first just on the side where you have sciatica. But in this case, if you have lumbar spine and you don't have neurological symptoms, do it both sides. So we push the knee away from us, we reach for the tension point, so we feel stretch. In this case, in the right piriformis, we keep the position 10 seconds, then we breathe in. When we breathe out, we push some more. We keep it for 10 seconds. We breathe in. When we breathe out, we push some more. We keep it for 10 seconds and then we slowly go back to the neutral position. This is a really good way to stretch the performing muscles without creating discomfort in the lumbar area, because we are going to keep flat the lumbar area. That's the trick. So make sure this is the position, make sure to keep the chin down, and that's it for this exercise. So what to say about this exercise? This performing stretch, it's really safe, but if it reproduces symptoms, for example, if you have a herniated disc and this exercise reproduces sciatica, you shouldn't do it. But you could generally do it if you have stenosis, if you have arthritis as well, but just make sure to test it and skip it if it reproduces symptoms, okay? So now let's do the child's pose exercise. How do we do it? We keep our hands just below our shoulders, our knees below our hips, and we reach for our heels with the glutes. So we sit in this position and then we shift with our hands toward. As you see, this exercise is going to create this curvature in the lumbar spine. So also with this exercise, if you have symptoms, if this reproduces pain and symptoms, don't do it. As you see, it creates this lumbar curvature. It's like rounded, could cause you some symptoms, some discomfort. In that case, do it with caution or just skip to the other exercises, okay? So I'm going to show you again how to do it properly. We keep our hands below our shoulders, we keep the knees below our hips, we sit on our heels, we shift with our hands toward, we keep this position for 10-15 seconds, and then we slowly go back to the neutral position. So that's it for this video. Share it, like it, subscribe to the channel. See you in the next video.